Hi, my name is Joanne Mejia, and I will be presenting the management and organization of the Vaccines for Children program, also called VFC. I chose the VFC because, as I have mentioned before, I work in a pediatrician's office, and we have many patients that don't have insurance or have insurance, but it does not cover vaccines. So we help patients get their well visits and vaccines, especially now that school is around the corner and the program allows us to do that. History. In 1989 through 1991, there was a measles epidemic in the United States that resulted in 55,000 reported cases, 11,000 hospitalizations, and 123 deaths. An investigation by the Centers of Disease Control and Prevention, also known as the CDC, resulted in more than half of children had not been immunized for measles, despite seeing a healthcare provider. So, in response to this epidemic, Congress passed the Omnibus Budget Reconciliation Act on August 10th, 1993, creating the VFC program and officially becoming operational on October 1st, 1994. And in 1994, the state of Texas began to participate in the VFC program, also called the Texas Vaccines for Children (TVFC) program. The legislation guaranteed that vaccines would be made available for children at no cost, also no cost to providers in order to immunize children from birth to 18 years of age who meets the eligibility requirements. Roles of those involved. So the VFC inside offers the parent, the guardian of the child needing vaccines, information on where vaccines can be provided and who to contact for answers and questions. The provider, whether currently enrolled or wants to know the incentives for joining the VFC program and how to order vaccines, the cost or fees involved. Another role that is also involved is the awardee, and they have the largest role. They perform all the paperwork, distributes the vaccines, compiles with changing state and federal regulations, manages the program, recruits and enrolls providers in the program, evaluates performance, provides quality assurance, and conducts provider site visits. They also do return, replaces, or file credits for vaccines. Management. The VFC program is funded by the Office of Management and Budget, OMB, and funds are distributed to the CDC. Then the CDC buys vaccines at a discount directly from the manufacturers and distributes them to the state health departments and certain other public agencies. The agencies then redistribute the vaccines at no cost to private physicians and public health clinics that are registered as VFC program providers. Governance. The CDC is responsible for policy development. The state health departments are responsible for management of the VFC program at the state and local level. Most states coordinate their state-level immunization programs with the VFC. The successful implementation of the VFC at the state-wide level requires the cooperation and coordination of several state and federal agencies, such as the Special Supplemental Nutrition Program for Women, Infants, and Children, known as WIC, also the Children's Health Insurance Program, CHIP, and also Medicaid. In fact, there are many patients that first learn about the VFC program through federal and state programs that the children already participate in, like WIC or CHIP. The participation and cooperation of Medicaid is particularly important as the majority of the VFC eligible children are also eligible for Medicaid. State and local Medicaid agencies play an important role in informing about the VFC program and recruit private physicians to participate in the program. agencies. These are some of the agencies that make it possible for the children to receive VFC vaccines, and also for the program to continue. For instance, the Health Resources and Services Administration is an agency of the U.S. Department of Health and Human Services. It provides care to people who are geographically isolated, economically or medically vulnerable, including people living with HIV or AIDS, pregnant women, mother or families, and those unable to access high-quality health care. Another agency is the Advisory Committee on Immunization Practices. They have the medical and public experts who develop recommendations on the use of vaccines and stand as public health guidance for safe use of vaccines and biological products. Then we have the Public Health Service Act, and they have the responsibility for preventing the introduction, transmission, and spread of disease. Another agency is the National Association of County and City Health Officials, and they launched an awareness campaign to promote the VFC program to reach those who qualify for the VFC but are not aware. Last, the program Vaccine Adverse Event Reporting System is a national early warning system to detect possible safety problems with vaccines. It accepts reports of adverse effects from anyone and anyone can report to the Vaccine Adverse Event Reporting System. Healthcare professionals are required to report all adverse events. And these are just some of them. There are other agencies. Healthcare providers. As of 2019, there are over 44,000 doctors and 40,000 locations enrolled in the VFC program nationwide. There are over 3,000 Texas providers enrolled in the TVFC, including more than 150 TVFC providers here in San Antonio and Bexar County. Texas leads the nation in the number of uninsured and underinsured children. In Texas, there are over 3 million children on Medicaid, and many of these children are not receiving or are not up to date on their vaccines. These vaccines help children be protected from vaccine preventable diseases. Patient eligibility. Children and adolescents are eligible if it is before their 19th birthday and they meet one or more of the following guidelines. They have to be Medicaid eligible, uninsured, American Indian or Alaska Native, or underinsured. The CDC estimates that about 50% of children under 19 years old are eligible for the VFC benefits based on these guidelines. The patient can only receive vaccines at locations that are qualified health centers. The child who is eligible for Medicaid program also refers to children who have health insurance by the state Medicaid program. A child that is uninsured does not have health insurance coverage. American Indian or Alaska Native, as defined in the Indian Health Care Improvement Act, is eligible for the VFC program to receive vaccines. Underinsured means a child has health insurance, but it doesn't cover vaccines, doesn't cover a certain vaccine, or covers vaccines, but has a fixed dollar limit or a cap for each vaccine. Each state has an administration fee for the vaccine not to excess over $15, and in the state of Texas, it is set at $14.85. Children whose health insurance covers the cost of vaccinations are not eligible for the VFC program, even though the cost and the administration is denied for payment by the insurance carrier. Recommended vaccines. The Advisory Committee on Immunization Practices makes recommendations to the VFC program as to what are the most appropriate selection of vaccines and related agents for control of vaccine preventable diseases in the civilian population of the United States. VFC resolutions passed by the ACIP form the basis for the VFC program policies on vaccine availability and usage. Resolutions are not necessarily match the general usage recommendations of the ACIP, but rather represent the rules that providers must follow for administering each specific vaccine under the VFC program. Vaccines in the VFC program. So the following vaccines are included in the VFC program. Any vaccinations on the immunization schedule are covered by the VFC. Diseases prevented. There are many single and combination vaccines that are licensed in the U.S. and protect children against 14 preventable diseases. I listed a few, and the preventable disease, for instance, the pertussis prevents the whooping cough, rubella prevents the German measles, the tetanus prevents the lockjaw, and varicella prevents chickenpox. I also have a chart with other vaccines and the diseases that they prevent. Receive vaccines. VFC vaccines can be administered by any enrolled VFC program provider, such as a private doctor, private clinic, hospitals, public health clinic, community health clinic, and schools. Many family practice providers, general practitioners, and subspecialty providers are enrolled in the VFC program. Underinsured children can receive vaccines from a federally qualified health center that provides care to the medically underserved population, including community and migrant health centers, special health facilities such as those for the homeless and persons with AIDS. There are also some near public housing and Indian health centers. These type of facilities receive grants under the Public Health Service Act. Rural health clinics is in a health professional shortage area, medically underserved area, or a governor-designated shortage area. RHCs are required to have a physician assistant, nurse practitioner, or a certified nurse midwife on staff at least half of the time the clinic is open. VFC state, territory, and city coordinators. VFC coordinators can assist providers with enrollment in the VFC program and answer questions they may have. Get more information as to how the VFC program works in the provider's area. VFC coordinators are also available to help concerned parents answer questions regarding immunizations and how they work for the child. They can also help answer or explain any school laws that govern how immunizations are administered based on the state law. Overcome an impact. By eliminating or reducing cost as a barrier to vaccines, the VFC program encourages improved vaccination among eligible children. It also increased protection not only to the vaccinated child, but to those around them. The VFC program results in millions of vaccines each year. For instance, in 2010 alone, 82 million VFC vaccines doses were administered to 40 million children. The CDC estimates that among children born in 1994 through 2013, routine childhood immunization will prevent 322 million illnesses and prevent 21 million hospitalizations. Vaccination programs like the VFC are expensive, but they also result in cost savings by preventing hospitalizations and doctor visits. So these are my references that I used for my PowerPoint, and I would like to thank you for listening.